Polio could be quietly spreading among unvaccinated people tonight. The virus that causes the disease has been detected in New York City's wastewater system, and it comes less than a month after a New York resident was diagnosed with a paralytic case of polio. That was the first in the U.S. since 2013. That man was unvaccinated, like many others who live in that area just outside of New York City. As of August 1st, only 60% of Rockland County residents were fully vaccinated against the polio virus. New York's statewide average is less than 80% right now. Dr. Gandhi specializes in infectious diseases at UCSF and joins us live tonight to talk more about polio, and if we've got some time, to talk about monkeypox as well. Dr. Gandhi, good to see you. So Bill Gates, the philanthropist and billionaire who has worked globally to try to eradicate many diseases, including polio, calls this latest news an urgent reminder that until we end polio for good, it remains a threat to us all. That's concerning. Do you agree?
Yes, I mean, actually, polio had been eliminated in the U.S. since 1979. There were a few cases in travelers, last one in 2013, but we've not had it since 1979. So this is a wake-up call that our rates of childhood vaccination worldwide have actually gone down during COVID. UNICEF called the alarm about a month ago, saying all rates of childhood vaccinations are down and we need to get people vaccinated.
So when you hear that in Rockland County, where this one case was identified, only 60% of the residents have the vaccine, is this the tip of the iceberg? And how quickly potentially could polio spread in that community and then others?
Yes, so it's true. This was surprisingly a low rate of vaccination. New York City, where it's also spreading, is about 80% overall across the boroughs, but each of the boroughs varies. I think that we had school closures, we had doctors' offices closed, we had people not wanting to come in for medical care. We have had some erosion of trust of public health that you've covered on this program. All of that together means that our rates are lower than they should be. Children usually get vaccinated at 2, 4, 6 months, and then again 4 to 6 years. So we need to catch up now and urge people to do it. Yes, I was surprised to see that low rate.
Let's talk about monkeypox here for a moment. Cases continue to rise nationwide. It has now been declared a national public health emergency. Are we playing catch up on this outbreak right now, given the fact that vaccine and resources have been so limited?
Yes, so the thing about monkeypox is we actually had a vaccine when it hit this huge outbreak. Right now we have an outbreak that's across the world, started on May 13th, and we didn't have to invent a vaccine from scratch. The smallpox vaccine has effectiveness against monkeypox. So countries did a better or worse job in getting vaccine out to their populations, mostly men who have sex with men, and the US, unfortunately, was slower than the UK and some places in Europe. So we are slow. People were still waiting in line to get their vaccines. We could have contained it better if we had better vaccine supply before this.
Well, another major headline on this front this week, Dr. Gandhi, was stretching the vaccine supply as a result of some of the concerns out there, getting a smaller dose. Is that sufficient? What's your message about that?
You know, I actually think it's a good idea. I know that there's some risk to it because we don't have wonderful studies that say, okay, this definitely is going to give you the same response if I give you a fifth of the dose into the skin, called intradermal. On the other hand, there's a huge precedent for giving intradermal vaccines instead of underneath the skin, right in the skin. Your immune system picks it up really quickly, and the WHO has endorsed this strategy for years, this idea that you can dose spare by giving less of a dose inside the skin. So I think we should do it to get more people immune, and then we can catch up later with a full dose.
Talk about the logistics about getting a vaccine, because we were having a discussion in our news meeting earlier this afternoon about the difficulty in getting a vaccine. Where are you supposed to go and get it, and who is administering it? It sounds like there's some unconventional options out there.
Yes, so it really is coming through the CDC, then through the DPH, through departments of public health. And so unless someone has access beyond the Department of Public Health, that is the conduit to most municipalities, and they're doling out, the central government is doling out doses to each city per their risk. New York is the #1 state with cases, California after that. And we put out an announcement every morning at the San Francisco Department of Public Health that the vaccine's ready from 8 to 11. And then unfortunately, people have to line up, and they have been lining up starting at midnight sometimes. So we have such few doses.
Yeah, and people being turned away. While I've got you, COVID restrictions, there was some major news tonight or this week out of the CDC, relaxing the guidelines around social distancing, quarantining. What's driving that decision?
You know, it really is the fact that it's been 2 years and a half. We have high rates of population immunity. We have a lot of people who've seen the virus, had the virus, and a lot of vaccinations. We also have tools, treatments, Paxlovid, other antivirals, and monoclonal antibodies. At this point, the balance has shifted, that we have the tools to protect against severe disease, and all the other restrictions have effects on education and people's mental health. And the balance has shifted, and basically the CDC caught up with what Europe did about 4 months ago, which is to essentially say we have to live with it like other respiratory pathogens.
Yeah, you bring up education, and the goal is to keep kids in school, right? We saw the ramifications and routine daily testing also going away for a lot of schools. Real quickly, how close are we to a yearly vaccine for COVID, just like we see with the flu?
You know, I think all older people will definitely get that starting now, and we'll get the Omicron specific booster in a month or two. And that's the booster they should get. Let's not boost with some old strain. We know we're going to get this updated one. Older people above 60 are probably going to get it every year. The question is, are we all going to need it every year or not? And that's going to depend on how much is circulating. After this, I hope it will go down.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.